Carmen, 47 years old, had been suffering from anxiety since her 20s. It appeared periodically, every 3 or 4 months, in the form of crises lasting a month and a half. She also complained of a feeling of dryness and constriction of the pharynx, as well as a feeling of chest tightness over the sternum that worsened in the evening. More recently, she had begun to suffer from claustrophobia. Her daily emotions were dominated by grief due to a massive empathy, as if she had no filter. She was also meteorosensitivity, that is, she was very affected by weather changes, especially in spring and autumn. Her pathology history included 2 surgeries for asymptomatic endometriosis. Well, the first thing I wondered was whether it was a Yingwei-mai, because of her fear, her pharyngeal discomfort, and her permeability to emotions, or either Chong-mai disorder, which was evoked by cold feet, her history of endometriosis, her short menstrual cycles, and the facial acne located around the lips. In addition, she defined herself as lazy. She disliked change and tended towards inertia. On the first visit, I tried Renmai 4, Chongmai's creative point. At the next visit, she told me, "I forgot to take my anxiolytics. I've got so much energy, much more desire to do things." The feeling of chest constriction and dryness in the throat had also decreased. This day, I tried another treatment, which I had also considered. Heart 7 with Renmai 14, but this one had no effect at all. As that day she had been feeling a little bit vulnerable, I opted to repeat the Renmai 4 puncture. 20 days later, she told me, "I feel fantastic. Apart from a little cervical pain, I have no complaints." Before being medically discharged, I still did 4 more sessions, none of which required Renmai 4 repetition. That was 8 years ago. Juanita, 53 years old, came to my office for high blood pressure, diagnosed since menopause. 3 years before, she had had a change of job, which had been desired and positive, but which she found challenging. Well, in fact, generally all changes were difficult for her. As explained in the theory video, for people with a tendency to suffer from Chong-mai disturbances, change can be difficult because one of the functions that resonates on this extraordinary vessel is the ability to mutate. Juanita's other symptoms were early insomnia, palpitations at rest, and vaginal, ocular, and skin dryness. She had also had significant menstrual delays during the climacteric period and hot flushes, although by the time I saw her, these were less pronounced. Recall also that hot flashes are another possible resonance of Chong-mai. There was also psoriasis on her big toe, the toe on whose meridian Chong-mai's key point, spleen 4 Gongsun, is located, and she was a person tending to be afraid and tending to avoid situations of violence and conflict. Well, the interesting thing about this case is that I started treating her with spleen 4, Chong-mai's key point. And not only did she not improve at all, but on the contrary, the hot flashes increased. Such negative response to the key point induced me to treat the Chong meridian directly. In her case, I chose kidney 24. This acupoint proved to be a turning point in her symptomatology. From this session, her blood pressure progressively dropped from 12.9 to 11.8. I finished treating her other reasons for consultation, also with phytotherapy, and after 14 visits, I discharged her from coming to see me. Her blood pressure was still normalized. I think that this case is of interest to specialists for two reasons. First, because we see that the key point of an extraordinary vessel may not always be useful, but may even be contraindicated. The second reason are the clinical indications of kidney 24 that matched well with my patient's symptomatology. This acupoint is often useful when a person is divided in an internal contradiction. In this case, the change of job, although having been desired and positive, was also challenging and therefore caused her suffering. And this ambivalence, together with the clinical symptoms, made me bet on this point with a satisfactory result. This shows that kidney 24, in her case, was the target point.